Hello, I'm Caroline.
Hey, I'm Chance.
Hi, I'm Asia.
Hi, I'm Taylor, and this is our presentation on development during the preschool years. So starting with some key points of this period occurs from ages 2 to 5 and is marked by rapid social, emotional, and cognitive development, and play and social experiences are critical for this. Though neurodevelopment goes, there are still many motor milestones achieved during this period that will influence balance, coordination, and play. So what are the gross motor milestones of preschool years? So development here is important for balance and coordination with milestones as simple as walking upstairs or on their tiptoes to hopping on one foot or climbing ladders. Gross motor milestones are essential for participation in play. For instance, some of the milestones mentioned previously will allow children to engage in games like tag or hopscotch. So for tag, they'll gain the ability to run after each other and do so safely. With hopscotch, they can hop on one foot throughout the path. What are the fine motor development milestones for the preschool years? So development here relates mainly to functional grasp, bimanual coordination, and manipulation of smaller objects, from actions as simple as scribbling to lacing shoes and unscrewing nuts or bolts. Fine motor milestones will mainly affect areas like independence and participation in play or school. For instance, children typically begin dressing themselves around the age of 4, and in order to do this, they'll need to be able to manipulate buttons or laces to button their clothes and things like that. And now children can incorporate construction into individual and group play. So what are the visual perception developmental milestones of this period? So development here mainly refers to a child's ability to visually discriminate regarding aspects like size, shape, and color. This starts with basic actions like recognizing primary colors and basic shapes to copying more complex patterns or recognizing their name in all uppercase letters. So the main effects of visual perception milestones here are that the children will be able to I'm going to restart this slide and then we'll cut, sorry. In terms of visual perception is the ability to interpret what one sees, and this will assess in areas like play and social participation and prepare children for school activities. So when it comes to play, children will begin interacting with their environment more, engaging in more exploratory behaviors, and incorporating others into imaginatory play. And when it comes to school, visual perception milestones here will prepare them for activities like reading and writing.
So during visual motor development within years 2 to 3, toddlers are just developing dexterity. They're able to use paintbrushes, fold paper, and use scissors. 3 to 4, the coordination improves. They're able to trace and use building blocks because they're much more stable. Within ages 4 to 5, they can draw items they recognize and piece together the visual motor skills that they learned in the previous years. Specifically with ADLs and IADLs, visual motor development affects being able to write legibly, coordination, and dexterity. Ultimately, vision is essential to observational learning as it relates to development because this is where children pretty much do what they see. Within cognitive development, at ages 2 to 3, they're very attentive. They become interested in how things work. Ages 3 to 4, they are able to sort and differentiate things, so they can progress to understanding about 75% of what adults say. Within ages 4 to 5, most importantly, their memory has developed, and so they are able to remember stories and songs and things of that nature. The cognitive development affects their occupational performance because it determines how they solve problems and strategize. This milestone is actually crucial to their development because it's important for them to be able to transition into school and social interaction at this age. All right, so within sensory development, the senses are actually highly stimulated during these ages 2 to 5 because they're able to distinguish what they can and cannot do. Examples here show that stimulation of the senses during these ages determine how they listen, how they respond, eat, and play. Sensory development enables children to learn and adapt to the physical environment around them. Whether it's a positive stimulation or it could be a negative response to sensory input, the things that they see, hear, smell, taste, and touch will ultimately determine how they view the world and who they will become.
All right, so now we've come to the communication milestones. So between 2 and 3, most important part about this age period is they develop private speech, which is where they talk to themselves. They're also expanding their vocabulary to understand roughly 1,000 words. And also around 31 to 34 months, they develop syntax. And also around 35 to 40 months, they develop sentence embedding. Strangers can also begin to understand 50 to 75% their speech intelligibility around this age range. And then around 3 to 4, they start to understand them a lot more with roughly 75 to 90%. And then around 41 to 46 months, they start to co-join sentences. And then between 4 and 5, it's most kids can functionally intelligibly speak to each other, and this is important because it's also expanding vocabulary, and the vocabulary is between 5,000 and 8,000 words. The implications of this are that developmental milestones that are created from this are the social interactions and imitation they start doing with others. They can begin to communicate and pay attention as they progress through this period and develop cognitive and social development. And then we're in the social and emotional milestones. So from 2 to 3, socially, they don't really deal with people outside their family, but they do become more interested with things that are going on outside. So typically what we look at here is the play. And so when it comes to play, they start to do parallel play, which is when they watch someone and they imitate them or mimic them. And solitary play also begins where they're just playing by themselves and they want more autonomy from their mother and father. And 3 to 4 in this age range, they start to copy adults and they'll console friends if they're crying. 4 to 5, they don't want to do solitary play or onlooker play anymore. They want to play with friends. They want to do cooperative play. And this is important because it starts to get to the point where kids are playing with each other. They're communicating, they're learning about their self-efficacy and school readiness for the coming years after preschool. Cronin and Mandich mentioned that the negative experiences from impairments could cause people to be left behind through cognitive, behavioral, social development that lead to depressive cognition and symptoms in the future. Some developmental delays are mentioned here. The risk factors for these delays are poor prenatal care, prematurity, genetic or acquired conditions, malnutrition or neglect, and these include poor head and neck control, muscle stiffness or floppiness, speech delay, swallowing difficulty, and so on. A few of the specific developmental delays that we mentioned here are cognitive delays for one, which can interfere with the awareness, causing learning disabilities. And this can also cause difficulty communicating with others and playing with others, which according to Cronin and Mandich, if you don't play with others, you typically get left behind. Motor delays can also lead to this, and also problems with hygiene, such as brushing teeth or tying shoes and grooming, holding toys when playing as well. Social, emotional, and behavioral delays can interfere with the child's response to process information because they process information differently from other kids. This can impact their learning and interaction with others. And then speech delays includes not only talking, but also listening and understanding what people are talking about. And these come through oral and motor weaknesses when trying to speak, receptive language disorders, which is when you're trying to understand it and expressing what you're trying to say.
According to Jared et al., maternal well-being is lower in families with children who are impaired. Some mothers are psychologically damaged by their mourning the loss for a wished for a normal child. Stress is a huge burden for parents of children with special needs. Mothers of children with autism had stress levels comparable to soldiers in combat. The most challenging aspect for mothers with impaired children is not the actual child, it's the labeling, stereotyping, separation, status loss, and discrimination. A few common challenges for one with an impaired child include missing out on family-oriented activities, encountering criticism and judgment, and feeling like an outsider around parents of typically developing children. Common worries for families that experience these burdens include worrying about the child's pain and suffering, their future, and the question of whether or not they're doing enough or doing the right things to help the child. Although many families experience challenges between their family and disablement, these challenges are all unique to their own situation, and they all learn to adapt over time and do what is best for their situation. As parents of children with special needs are often exhausted and frequently become depressed, here are some of the top self-care and support options available. In the preschool years, there are many lasting health trajectories that begin. Trends to different lifestyles are established at this very young age. American preschoolers are at a higher risk for trends of a sedentary lifestyle and obesity. So how can teachers, parents, and organizations combat negative health trajectories for American preschoolers? Improvement among preschool accessibility and quality, which includes the Every Student Succeeds Act, targeting the achievement gap, parent education, technology awareness, and greater focus on physical fitness are just a few ways these trends will improve in a positive way over the next 5 years. These sports are beginning younger and younger each year. Overall, quality of preschool matters and is especially beneficial for children from low-income families, as it helps them stay on track throughout grade school. Programs are currently focusing on improving students' vocabularies, as well as their social and emotional development, which will be important across the entire lifespan. Educating parents and helping the transition from home to school will create a positive effect for those children and their families. Allowing more exposure to technology in preschools will allow children to be more prepared for their future, involving the technologically advanced society. We hope you enjoyed our presentation. Thank you for watching. And here are our references.